Hey everyone, today we're going to talk about something really important that people don't always like to talk about. Sexually transmitted diseases, or STDs. Don't worry, we'll keep it simple and easy to understand. We want to get rid of any shame around this topic and help each other learn. And that means talking openly and honestly about sexual health. Because let's be real, these things are important and ignoring them won't make them go away. So, whether you're having sex or not, this video is for you. We'll talk about the basics of some common STDs, what they look like, how they're treated, and most importantly, how to protect yourself and the people you're close to. Let's get started. First up, we've got chlamydia, which is kind of like a shy guy in the world of STDs. Why so quiet? Well, most people who have chlamydia don't even know they have it. Yeah, you heard that right. Lots of people don't have any signs, but for those who do have signs, it's usually like having a bladder infection. Think about that burning feeling when you pee. Not fun. And then there's the weird discharge. Definitely not a good surprise. Now, before you start to worry, here's the good news. Chlamydia is super easy to treat with antibiotics. It's like a quick trip to the doctor. You take some pills and bam, you're all better. But here's the thing. If you don't know you have it, you could accidentally give it to someone else. And that's why getting tested regularly is so important, folks. Knowing is better, especially when it comes to your sexual health. Think of it like this. You wouldn't skip going to the dentist and then be shocked if you had a cavity, right? Same goes for your sexual health. Regular checkups mean catching things early and staying healthy. So how often should you get tested? Well, that depends on a few things like how many partners you have and if you're more likely to get it, but it's always a good idea to talk to your doctor about what's right for you. Remember, there's nothing wrong with getting tested. It means you're being responsible and taking care of yourself. Plus, it gives you peace of mind, and who doesn't love that? Next up is gonorrhea, which some people call the clap. And no, it's not the kind of clapping you want. Like chlamydia, gonorrhea can be sneaky and hide without you knowing, but when it does show up, it's not pretty. We're talking burning when you pee. That, ouch, this is not right feeling. And then there's the discharge, which can be a lot heavier than with chlamydia. Now, the good news is that gonorrhea is also treatable with antibiotics, but here's the catch, it's getting smarter, folks. We're talking about antibiotic resistance, which basically means the bacteria are learning how to fight off the medicines we use. That's why finding it and treating it early is super important. The longer you wait, the harder it is to treat, and the more likely it is to cause other problems. We're talking about serious stuff like not being able to have children and pain that lasts a long time. So how do you avoid getting tricked by the clap? Well, practicing safe sex is a great place to start. Condoms are your best friend, people. And yeah, they might not be the most romantic thing in the world, but trust me, dealing with gonorrhea is way less romantic. And of course, regular testing is super important. If you're having sex, especially with different people, make those appointments. It's better to be safe than sorry, right? Remember, knowing is power, and taking charge of your sexual health is one of the bravest things you can do. So let's be smart, be safe, and beat gonorrhea at its own game. Chapter 3, Syphilis, the Great Imitator. Now, let's talk about syphilis, the master of disguise in the world of STDs. This one is sneaky, starting with a sore that doesn't hurt and might go unnoticed. You might even think it's an ingrown hair or something. But don't be fooled. If you don't treat it, syphilis can hang around for years, hiding in your body and causing all sorts of problems. We're talking about serious health issues like heart problems, losing your sight, even not being able to move your body properly. Not exactly a walk in the park, right? The good news is that if you catch it early, syphilis is easily treatable with penicillin, a type of antibiotic that's been around forever. But here's the thing, the longer you wait, the more damage it can do. So how do you catch it early? Well, remember that painless sore we talked about? That's your sign to get tested. And if you're having sex, regular testing is key, especially if you have different partners. Syphilis can look like other health problems, making it even harder to figure out. That's why it's so important to pay attention to your body and talk to your doctor about anything that seems off. Don't let syphilis fool you. Be aware of the signs, get tested regularly, and if you do have it, get treated right away. You'll be glad you did down the road. Chapter 4. Herpes, it's more common than you think. Let's talk about herpes, a word that often makes people uncomfortable. But here's the thing. Herpes is incredibly common. We're talking about 2/3 of people around the world having some form of the virus. There are two types of herpes: HSV1, which usually causes cold sores, and HSV2, which usually causes sores around the genitals. Both types can cause painful sores and blisters, and while there's no cure, there are ways to manage outbreaks and reduce transmission risk. Antiviral medications can help shorten the duration of outbreaks and make them less severe, and there are things you can do to prevent outbreaks, like managing stress, getting enough sleep, and avoiding triggers like sunlight or certain foods. Now let's talk about transmission. Herpes can be spread through skin-to-skin contact, even when there are no visible sores. That's why it's important to talk to your partner about your sexual history and get tested regularly. If you do have herpes, know that you're not alone. It's a common virus, and there's no shame in it. The most important thing is to manage the virus, protect your partners, and live a healthy, fulfilling life. Chapter 5, HPV Vaccines and Vigilance. Last but not least, let's talk about HPV, or human papillomavirus. This one's a bit of a chameleon with over 100 different types. Some types are harmless, while others can lead to genital warts or even cancer. Now, before you freak out, here's the good news. We have vaccines that can protect against the most dangerous types of HPV. These vaccines work best when given before someone becomes sexually active, but it's never too late to talk to your doctor about getting vaccinated. Even with the vaccine, it's still important to be careful about your sexual health. Regular pap tests can help detect any abnormal cells in the cervix, which can be a sign of HPV infection. Remember, HPV is incredibly common. In fact, most people who are sexually active will get HPV at some point in their lives. But the good news is that most HPV infections go away on their own without causing any problems. The key is to be proactive about your sexual health. Get vaccinated, get tested regularly, and practice safe sex. By taking these steps, you can protect yourself and your partners from the potential risks of HPV. So, there you have it, a crash course on some common STDs. Remember, knowledge is power, and taking control of your sexual health is one of the most empowering things you can do. If you're really concerned, consult your health practitioner, and if you have any knowledge about STIs that we may have missed, please comment down below. Don't forget to like the video and consider subscribing. Stay safe, everyone.